Table 5-1 covers the muscles that move the pectoral girdle. And if you remember, the pectoral girdle is the clavicle and the scapula. The first muscle that we look at is the most superficial muscle of the back, and it is the trapezius. It is a big trapezoid-shaped muscle, and its point of origin is along the back of the skull. This white line here, which is called the ligamentum nuchae, and the spinous processes of T1 to T12. And its insertion will be on the lateral third of the clavicle, the acromion, and then the spine of the scapula. So there are three different regions of the trapezius. We have this superior region where the fibers are running down. We have the middle region where the fibers are running side to side. And then we have the inferior fibers, which are ascending. So when a muscle contracts, the point of insertion will move closer to the point of origin. So when the superior fibers contract, it will elevate and upwardly rotate the scapula. So if you think of the glenoid cavity as your point of reference, it's where the head of the humerus fits in. If it moves directly upward, that is an elevation of the scapula. If the glenoid cavity rotates up and inward, then that is an upward rotation of the scapula. The superior fibers also extend the head. So if the head is already in a flexed position, the superior fibers will bring the head back into midline, and that is extension, or beyond midline, which is hyperextension. The middle fibers will pull the scapula in closer to midline. So if you think of the medial border of the scapula, if it gets pulled closer to the midline of your body, then that is adduction or adduction. And then the inferior fibers, they will depress the scapula, which is the opposite of elevate the scapula. So they'll move the glenoid cavity or fossa directly inferior. The levator scapulae works synergistically or works together with the superior fibers of the trapezius to elevate the scapula. So to see the levator scapulae, I need to hide the trapezius muscle. So just underneath, you can see that the levator scapulae, its point of origin will be up in the neck, and its insertion is on the superior angle of the scapula. So when it contracts, it pulls, again, the scapula directly upward. The rhomboid muscles are on the same plane as the levator scapulae, and they are these rhomboid-shaped muscles that are attached to the medial border of the scapula. So that is their insertion. The origin is going to be along the spine of C7 to T7. So I group the rhomboid minor and major together because they have the same action. And that action is to stabilize the scapula, and that just means to fix the scapula to the thoracic wall, to elevate the scapula, and to adduct the scapula. It also has the function of downwardly rotating the scapula. So if the glenoid cavity moves down and in, that is a downward rotation.
The serratus anterior is another very deep muscle, and it is right up against the rib cage. So just under the arm, you can see this muscle that has a serrated edge to it. This is the serratus anterior. So this is where its origin is, and its insertion is underneath the medial border of the scapula. So when this muscle contracts, it's going to pull the scapula away from midline, or abduct the scapula.
The pectoralis minor we'll see on the anterior surface of the body. So I'm going to remove the pectoralis major, which is that big muscle that we just removed. And here we can see the pectoralis minor. It somewhat has a serrated edge as well, but then it has an insertion on this coracoid process of the scapula. If you remember, the coracoid process was that little finger-like projection that points anterior on the scapula. So the job of the pectoralis minor is to abduct and depress the scapula. So when these muscle fibers contract, it's going to abduct, so it's going to pull the scapula away from midline, and it will depress the scapula. So since the fibers are running in a downward motion, it will cause a depression of the scapula or a movement directly downward.